Protein is interesting because its process actually starts in the stomach. So the stomach is really important for protein, and we actually do our first breakdown with acid and an enzyme in the stomach, and actually whole proteins, by the time they leave the stomach in normal anatomy, are broken down about 40% of them completely, all the way to their smallest component. Okay, so you can imagine in a gastric bypass where we now just have this little tiny pouch, or even in a sleeve, some part of that process is going to be changed, right? Then if we do some bypassing, like in a gastric bypass, we actually start to then bypass some of the places where those amino acids, the components of protein, would be absorbed. So the longer a bypass is, the more challenging that can be. So we have some changes both to digestion, that's what's happening up in the stomach, and potentially, depending on a procedure, to absorption. Now the good news is that those little components of proteins, amino acids, are actually absorbed through the entire small intestine. So they're absorbed really well everywhere. So we almost never see a real protein malnutrition with any of the procedures that are being done here. Have you ever seen one in your years of, you've been practicing a long time, right? You've probably never seen one. So that tells me two things. It tells me your body is really smart and it tries to get what it needs, and by and large, people get the message about protein and that it's really important for them to do after surgery, and they pay attention to it, okay? And so these cases, we tend to only really see these clinical cases of protein malnutrition, either in people who really stop taking care of themselves, who get sick with something else for another reason, so they get another illness on top of having had weight loss surgery, or they have one of these very malabsorptive procedures like a duodenal switch. That's really the only places we tend to see it. Now, it doesn't mean it can't happen. And there is some evidence that we may see, and I'll talk about this in a minute, some people who, while they don't get truly protein malnourished, that they may kind of still not get an adequate amount of protein. And there's some other ways that that's starting to be looked at, and I'll talk about that in a minute. So usually for gastric bypass or sleeve, most people are recommending a range of protein sort of somewhere between 50 to 80 grams of protein a day. Okay, that's usually the common range that we see, and most people do fairly well getting that in, but not always every day. And so, you know, a place where this sometimes shows up is a few years out of surgery, when people, you know, suddenly you can eat more, right? So anybody here 2, 3, 4 years out of surgery? Anybody? So after a little while, your range of foods that you can eat really expands, right? But what we find when we study people who are further out of surgery is that while the range of foods that they can eat expands, usually the calories they take in or the amount of food they consume doesn't change all that much. So they've done long-term studies of patients and really shown that gastric bypass patients, for example, rarely ever get above, on a regular basis, 12 or 1,300 calories a day. That's really small for long-term life intake. But what does happen is people can eat more diversity. They start to include more foods in their diet, and the proportion of protein they're eating may drop. So we see some studies like this where we may see that, you know, 10, 15, 20% of people on a daily basis may not always be meeting their protein needs. So I think, you know, the message that I would give is that this is something that I think people tend to do a really good job with the first couple of years after surgery. And as you start to get past that point, you may really need to watch yourself a little bit more carefully on a day-to-day basis and make sure that you're getting it. Is it okay to not get your protein in 100% of the time? Okay, just don't listen. Where's the dietitian? Tell her not to listen for a second. Yeah, if you do it for a day, do it for a couple of days, is it going to hurt you? No. If you do it for a couple of months, is it going to hurt you? Yes. Okay, so, you know, and if you have other challenges, if you're a vegetarian, for example, vegetarians have a much harder time getting in the protein they need, especially after a procedure like gastric bypass, because vegetarian sources of protein tend to be bulkier. They take up more space. Things like that. So there can be other things that come into play. So this is really kind of a forward thinking, especially for those of you who are early on, is, you know, as you get further out and you can eat more food, you can't forget that protein is still one of the most important things that you have to get in every day. And I'll say something else about this slide. This was actually a study that was done in a plastic surgery office. So how many people thinking of plastic surgery in their future one day, potentially tummy tuck or things like that? And it is a thing that people are often thinking about at some point, you know, and sometimes it's a thing that people really need. Sometimes reconstructive surgery really helps people be more mobile or be better able to do exercise, things like that. So plastic surgeons think a lot about protein because when you have bariatric surgery, Dr. Yadegar makes teeny tiny little holes. Those heal really well. they're really small. Big incisions like they make with cosmetic surgery are often much harder to heal, and it takes a lot of protein to heal them. More than healing, it's like burns and huge incisions take a lot of protein to heal. So the plastic surgeons often look at this very critically, and they say, wow, we really need to get people's protein way up so that they can heal when we do this, so that they have nice, pretty, thin little scars instead of big, ugly wounds that don't heal. So that's why they tend to study these things. About 18% of their patients showing up with at least a mild degree of vitamin A deficiency. So they looked into that a little bit further, and they found, so I said I would talk about protein and maybe some low-grade representations of protein deficiency early on. They found that this was more of a chronic thing that was showing up in patients 3, 4, 5 years after surgery, in patients who had slightly depressed protein. So they didn't have protein that was so low that they had protein malnutrition where they were very sick that way, but protein does a bunch of stuff, right? We build muscle with it, it's part of our immune function, we do tissue repair with it, but one of the other things it does is it carries vitamin A around your body, okay? So it carries some other things around your body. And if you're not taking in enough on kind of a chronic basis, protein will do its most important jobs and kind of get lazy with its less important jobs. So apparently carrying vitamin A around is a less important job than keeping your muscle healthy and doing tissue repair, which is probably good overall, but it's not good long term. So actually what they found in these patients is they really didn't have what I would call real vitamin A deficiency. They had not enough protein to get the vitamin A moving around in their bloodstream so that when their doctors drew their blood, they couldn't see it. Does that make sense to people? And once they got their protein levels back up, once they got them taking in more protein, suddenly that vitamin A sort of reappears because they're now carrying it around in their body.